So welcome to today's webinar on the recently launched AHP Student Buddy Scheme. The webinar is going to be recorded, so please feel free to switch your cameras off, and the recording will be available afterwards on the Love Our Learners catalogue on the Learning Hub or on the AHP website, where you can also download the guide itself. Please could you turn your microphones off and add any questions that you may have into the chat, and we'll try and answer those at the end of the session. For those of you who don't know me, I'm Jenny Davis and I'm the AHP Repair Fellow in the Midlands. Joining us today we have Yogita Stokes, who was a previous Repair Fellow and who started all of this work off, did most of the research and background information to be able to produce this. We also have 4 students, Yasmin, Jenny, Anyim and Asha, who have all come from De Montfort University, where they're doing speech and language therapy and diagnostic radiography, and they've had first-hand experience of being part of a buddy pair, so they'll be able to give us their experiences of what it's like to be in a buddy scheme. I'm going to hand over to start off with to Yogita.
Lovely, thanks very much Jenny, and hi everybody. So as part of the Midlands Repair Fellows work, we focused on initiatives to reduce attrition in Year 2 students. So we know that students on healthcare courses have a higher attrition rate in Year 2, and the 2018 Repair Report found that student buddy schemes were an effective way to provide peer-to-peer support for students. They also had positive evaluations, which may contribute to reducing attrition, and 50% of students that had participated in a buddy scheme in the report found this beneficial to settling into the course. Next slide, please, Jenny. The gold standard for buddy scheme is for all healthcare students to have access to a buddy scheme. So this is from the Capital Nurse Support Framework for Year 2 nursing students. The impact of COVID-19 student survey 1 and 2 from 2020 and 2021 found that AHP students were more likely to consider leaving the course during the pandemic, and the main reason was having less support, feeling stressed or overwhelmed. We also have some small data from the November 2021 NET survey, which found that paramedic, ODP and diagnostic radiographer professional groups reported lower quality placement experiences. So we take this data into context. So it was the time of the pandemic, the number of AHP responses to the NET survey was low, but along with local intelligence and data, this could give us some areas that are highlighted that we need to work on. And we do know that more emerging evidence supports that students from BAME backgrounds and from underrepresented groups have shown greater benefits from buddy schemes, and this can influence their academic attainment. Next slide, please, Jenny. In 2018, recommendation 5 of the Repair Report advised that HCI should review, in partnership with their students, the institution's approach to buddy schemes for healthcare students. Buddy schemes can be uniprofessional or multi-professional and link peers with less experience and more experience together for support. So although buddy schemes are popular and they are of value, and there's numerous around, there are gaps in knowledge and understanding about schemes. So further work is needed to understand what a buddy scheme is, how they're set up, what good quality buddy schemes existed and what the evaluation showed. And with this information, we can then begin to start some work around what makes a good buddy scheme and talk about recommendations for developing existing or setting up new AHP schemes. Next slide, please. So in April 21, as part of my role as a Repair Fellow, myself, Sarah Coffey and Kerry Walters led 2 focus groups on a small number of midwifery students that were buddies when they were students. So one focus group was for junior buddies, and the second focus group was for the senior buddy and the Midwifery Society lead that had set up the scheme. So the scheme was set up and born out of need. So midwifery students put into practice a peer support model which they felt was needed. So what we wanted to understand the benefits of the scheme, any barriers to the successfulness of the scheme. Did the midwives find this a positive experience when they were students? And did this impact on whether they continued on their study and their course? And we also wanted to know were there any improvements? So the benefits included peer support, sharing that lived experience with someone more senior than them that had already gone through the course or was going through the course. They talked about friendships. So friendships for some of the students continued into their working life, and they found the support useful for when they were going for job interviews or starting work. They found that the scheme helped to develop the students' confidence and organisation skills. There was quite a few challenges, mainly to do with organisation of the buddy scheme. It was opt-in and voluntary, so if you had a large cohort or two cohorts in a year, it could be difficult to organise. If students didn't get on or they weren't compatible and they didn't find the buddy relationship useful, there was not really anybody to turn to. And some of them found that if they had difficulties, or they didn't join the scheme because they didn't know the benefits of the scheme, how would you promote and support the scheme to everybody so people could understand that?
Yeah. You might have to download it and forth.
They then talked about setting boundaries, so both buddies understood the aim of the scheme and its remit, which a lot of schemes already do. The understanding of what peer support was, and this wasn't a replacement for obviously tutor support or formal support from the university. So they talked about a buddy agreement or a contract which would outline these boundaries. They talked about how signposting and training and support for signposting to other university services like mental health and signposting them to their peers were important. And they talked about organisation. So as we said before, support and organisation from the HEI. So if the buddy needed more support or they struggled, the senior buddy, who could they turn to? What training did they need to be able to be a good buddy? The impact, they were overwhelmingly positive about the impact on the benefits for it. They really enjoyed, most of them really enjoyed the buddy relationship and felt it supported them staying on the course, some more than others. So one or two of the midwives felt it was quite crucial, the buddy relationship, when they went into the pandemic and went to more isolation and virtual learning, and they were balancing their clinical placements with their academic work. They could really struggle and often wouldn't seek any help. So their buddy really supported them with sort of calming them down and signposting them to the right support services from the university. So we then worked on a national scoping exercise. So we wanted to know what a buddy scheme was and what already exists. So in 2021, we carried out a national scoping exercise. This was distributed, so a data collection tool was distributed through our previous regional repair fellows to mainly HEIs and NHS trusts, and we did have a variable response. And we had a lot of interest in our work. Many people were interested in future buddy scheme guidelines and frameworks for AHPs. And during the pandemic, we found that schemes had stopped, some were not deemed fit for purpose or had paused, and some had become virtual. So the data collection tool was split into the design and the evaluation. So that for the design of the scheme, we gathered information on the type of scheme, which professions were involved, why the scheme was set up and how it worked, and was it co-produced with the buddies or healthcare provider if they were on placement at the same time. And we wanted to know, did they match people for shared characteristics or compatibility? We also wanted to know how they marketed and promoted the scheme, and did they collate demographic data on the number of underrepresented groups or people that had accessed the scheme. And we wanted to know the benefit to the students, the HEI. And we found that no one had collated any information on the impact on attrition. So as we looked at the data, a picture started to emerge about buddy schemes. So there were lots of generic multi-professional schemes designed to support a transition of students to university in the first term. but they didn't necessarily match professional to professional group. And there were pockets of schemes solely for AHP groups. So the term buddy scheme has different interpretations. So a buddy scheme is any scheme where we have peer-to-peer support between a more experienced and less experienced person. But the term is broad, and under the umbrella of this, it could include peer mentoring schemes, it can include peer-assisted support, study support, and it can include peer-assisted learning support, which is mainly focused on educational, clinical and study skills. So the purpose of this webinar, and for the purpose of the guide work and frame, we are talking more about the informal and pastoral social support that is encompassed in the buddy scheme. So schemes can be one-to-one or group delivered, virtual or face-to-face. And the findings, so the findings of the data collection exercise. So we found that there were some pockets of really good practice within buddy schemes. There was some great virtual training support packages and modules to train buddies. There were group sessions and some virtual sessions for some buddies to come back together to talk about their learning experience and support each other and problem solve. There were buddy contracts and agreements that were in place. And we found that some buddy schemes focused more on underrepresented groups. And we found that some schemes were paid and some were voluntary for their buddies. The voluntary ones often had incentives for things like drinks or Amazon vouchers or things like that. But there was limited evidence on evaluations. So in summary, this guide was developed from using the evidence and recommendations outlined in the repair report on buddy schemes, combined with data from the national scoping exercise, which highlighted these pockets of best practice in schemes, and the focus group qualitative data. We also developed the guides from communication with the HEIs that had run AHP schemes or were interested in setting up schemes. And we considered the impact of COVID-19 student survey data, the NETS data, and the national priorities for reducing attrition in AHPs. And the guides and principles have been received positively from ODP course leaders and paramedics, as well as the Midlands Learning and Development Trad Council. Thank you, Jenny.
Thank you, Yudgita. So just to bring that bit more into practical focus, the buddy schemes need to look at how they're going to look at framing that buddy scheme and how they're going to focus it. So like Yudgita's just said, there's no particular evidence to support one way or another, but it's really key to try and think about how to set up those buddy schemes in thinking about the three priorities that we may potentially use. So widening access, supporting our underrepresented students, linking students with a qualified practitioner in a local healthcare provider, or linking students with more senior students of the same HEI and same profession. So that framework to be used is really key, that we bring in that collaboration between the student, the healthcare provider, and the HEI itself. So as Yudgita said, it's really key that we get it right. We recruit the buddies into the framework. So a good buddy is somebody who is prepared, that friendly face, that informal source of information, somebody who can share their experiences and a good listener. To be able to have opportunities to be able to introduce and pair up those buddies. So pairing up is vital to be really quite early on in the term. So definitely in year one, as early as we can in year one, to be able to get the most out of those pairings. And like Yudgita's just said, being able to give them opportunities to be able to meet up and having social events and meetings where the timetables will allow. It's also really important to promote the scheme unless you're going to embed it and into your curriculum. It's really important that the students are aware of it and how it can benefit them. potentially using senior buddies as ambassadors. And that, like I say, that collaboration is really, really vital. Really using the wellbeing, safety and quality, diversity teams to be able to really build up what they are doing already, and not just adding on. We can actually use those schemes alongside. Making sure we've got the right support network for the buddy schemes to be successful, to be able to give that contract to be explained what the boundaries are of the scheme, and to be able to provide potentially training to the more senior buddies on confidentiality, wellbeing, safety, and how to signpost to other HEI services or placement services. Potentially be organising a fund or funding a support officer to organise and manage and evaluate the scheme, to be able to do that. And finally, to evaluate the scheme for the benefits seen and on the return of investment. There is a repair cost calculator that can assist with how to cost up a buddy scheme, which is available on the repair toolkit. A link is in the slides, which will be available after this event. There are obviously benefits on multiple levels. I've listed here some of the ones from a HEI point of view and the healthcare provider point of view. Much of that evidence is anecdotal. I'm going to leave the benefits of the students to Yasmin, Jenny and Anyam and Asha to explain what their experiences of a buddy scheme has been. But it's really about providing that culture of support and building a sense of community where student experiences is really important to the organisation, and really demonstrating that they value the students a long way. Due to the support provided by the HEIs that have found one-to-one tutor time more focused on academic areas, so they're not necessarily dealing with all of the pastoral issues that students come with, because much of those have already been dealt with by the buddy. And by dealing with them at an earlier stage, we're able to prevent students from getting into that crisis situation. The schemes are relatively low cost to be able to set up and maintain. And now I'm going to hand over to Yasmin, Anyam, Jenny and Aisha to ask them to explain to you what their experiences are. I'm going to stop sharing my screen so that they can come on to the chat.
Hi.
Hello, Ali. Are you there? I know Jenny was struggling with her connection.
I think we've got, I think everyone is there.
Ah, here's Yasmin.
We've got Anjum as well. Hi. Hi. Hello. Hello. Anjum, I know Jenny was struggling. Whether Anjum's there. There she is. Anjum. Hello. How do you want to start it, Jenny?
I can go ahead and say it first if you would like.
Go for it, Yasmin.
Yeah. So hello, my name's Yasmin. I'm a speech therapy student, and I've been both a junior and senior buddy as I'm in my third year. So I've kind of experienced both sides of the coin. And well, for me, it was all about sort of expanding my knowledge and learning and going on. So when you want to learn or go beyond your current knowledge or understanding, you learn from people who have gone beyond their breadth of learning. So so it's always a valuable way and sort of guidance from someone who's done that. And this kind of applies to any subject or scenario. That's why I found the peer mentoring scheme really beneficial, as it provides the ability to help exercise those critical skills such as building confidence, or simply creating new opportunities for professional growth and networking, which is an important aspect in the professional world. So essentially, peer mentoring can be have many positive impacts on both yourself as a mentor and for the mentee itself. Of course, there was some hesitance and apprehension at first, and that's where, to be honest, though, your mentoring skills can come in. So we must find the right approach to get people on board and understand the balance between independence and guidance. And it's, in a sense, it's not just about mentoring for the sake of mentoring. When you're a speech therapist, we have to follow certain guidelines, and I'm sure the audiologists and other professions also have to do that, such as the standards of proficiency, HCPC, where effective communication and working well with others is advocated quite frequently. So it's a collaborative effort of applying those rules, and later in our career, we will be monitoring students or other allied health professionals. And we're constantly giving feedback and coaching others on their progress, and all that applies on working with a multidisciplinary team in general. Yeah.
Thank you so much, Yasmin.
Good.
Aisha, do you want to go next as a diagnostic radiography student?
Yeah, so my name's Asya. Yeah, as I said, first year diagnostic radiography student. My experience having a mentor has been really great. Specifically coming onto this course, I was very apprehensive about a lot of different things, such as assignments, hospital placements. This is my first time in a clinical setting. All of that was completely new to me. So having a third year that was more knowledgeable than me, that had all that experience, gone through all of it before, made me feel a lot more confident because I could ask them questions. And in particular, the way it sort of worked with us, we had our sessions actually scheduled into our timetable. In that time, we could do whatever we wanted. For example, as a radiography student, I was struggling with my position and centering points. So I explained that to my mentor, and what we did is she suggested booking in the X-ray room we have at DMU. So we booked that, and we went through like possible patient scenarios. For example, like a patient with shortness of breath needs a chest X-ray, how that would show up on a request form, sort of like the abbreviations that could possibly come up. And then it sort of should be the patient, I'd be the radiographer, and then she'd give me constructive criticism, constructive feedback, sort of what I could do better, what I could say better, what I could sort of word differently in the actual clinical setting. And that makes me feel a lot more confident actually going into placement and dealing with those real life scenarios. Yeah, in general, any sort of worries I had, she'd just be a message away. We sort of exchanged phone numbers, and she'd always give me advice if I need it. Not only that, also on placement, just seeing like a friendly face when you walk through the corridors, or maybe sometimes you're put in the same place, just seeing a friendly face really helps, especially being on clinical placement in places that you've just gone, for example, new hospital, and you've not really met any staff yet, you don't know who anyone is, and just seeing someone like, like, okay, someone, that's what else. We also, if we sort of were based in the same hospitals, we would go to lunch together sometimes, talk about my placement experiences, get advice. Yeah, overall she was just a really great support system for me, and it wasn't just sort of only a mentor-mentee sort of dynamic. In the end, we actually built a proper friendship, I think, which was really, really nice. Yeah, so to sum it all up, it's really been invaluable, I think, having the peer mentoring system.
Thank you ever so much, Aisha. And Anyan, do you want to join in the conversation?
Yep. Hi, so my name is Anjum and I'm a first year speech and language therapy student. So I've only been on the mentee side of it right now. I really enjoyed this experience. I think the support and reassurance you get from a buddy scheme can't be matched by a lecture or something else because of how informal it is. Particularly with me, I was quite nervous and overwhelmed when placements were introduced really early on, but just having someone who's experienced it before and just had tips on what you could say, how to communicate, how to conduct yourself, even little things like clothes. It's really reassuring and comforting because it just helps you have that little bit extra bit of preparation, so you're not completely overwhelmed and you have an idea of what may happen. Also, I think particularly for me, in my personal experience, when I began university, it was a little bit overwhelming because it was really full on, but just seeing what I could achieve in the next 3 years and what it might be like, what benefits, what I could experience, was really helpful to keep me going and determined to stay on and continue. I think I got on really well with my 3rd year. So just we had 3 planned meetings and 2 of them were scheduled on our timetable, but having the flexibility to meet in our own time if that didn't match us, or doing a Teams meeting or whatever for our needs, was really helpful as well. So overall, I think I had a really positive experience.
Thank you so much, Anya. Unfortunately, Jenny Stone, who was going to be joining us from Diagnostic Radiography student, is having technical difficulties, and she's trying to email me her comments through to me as we speak. So hopefully I'll be able to bring those up towards the end. Thank you so much, the 3 of you here, and thank you to Ali for supporting you all to be able to join today. I think that's really valuable, being able to get your lived experience, because it's you we're doing this for. So thank you very much. I'm just going to share my screen again. So the recommendations that we have put together in the guide have been developed from the evidence as discussed and are aimed at the HEIs to consider the setup and enhancement of any current buddy schemes against that evidence. So really to try and really build that adaptability, that responsiveness in, so that students can have that access to information as quickly as possible and prevent any crisis situations. But the biggest recommendation is to evaluating the impact on the student, evaluating the cost effectiveness, evaluating the scheme itself against the evidence, and also to realise the benefits of that transition, particularly from year 3 to the newly qualified practitioners. In terms of next steps, this recording will be available on our Love Our Learners catalogue on the Learning Hub, where you can download the guide. And you can access it via the link, which will also be available following this. And there's also the link on there to all of the different repair reports, including the repair tool, which has the link to the cost calculator that the York Consortium put together. We have provided HEIs in the Midlands that run operating department practitioner, therapeutic radiography, diagnostic radiography and podiatry programmes at pre-registration level to undertake a scoping exercise to review how they would look at their own buddy schemes and how they could potentially enhance it and look at it against the evidence. Being able to provide us with some more information, really, to be able to pull together a bit more of an implementation plan to enable HEIs to know what they're setting up for, because we don't have that complete evidence available to us at the moment. I'm also linking up with the repair fellow in London, who is looking at what training is provided or available for more senior buddies, and we'll be able to pull that together into an implementation toolkit in the summer. I'm going to hand it over to you guys now in terms of if there are any questions on the buddy scheme, or if there's any concerns about what some of the asks are. So I'm going to ask if Yogita, Ali and Yasmin, Anisha and Anyam can come back on and just answer any questions that anybody may have. So there aren't any questions at the moment in the chat. Does anybody have any questions? You can put your hand up and shout them out. Kathy.
Hi, that's all really interesting to hear about, something that I was, really new to and not aware of. I work for an integrated care board with their placement expansion programme. So I'm interested to think about, when we're trying to increase student placements, how many of these students might be using the buddy scheme. My actual question is, do you have any idea how many of the HEIs have put a buddy scheme in place, and whether it's more likely to happen with certain professions compared to others?
Yogita, do you want to answer that as you did the scoping?
Yeah, that's fine. So we had limited responses to the scoping exercise, so it was difficult to ascertain, but then we obviously went down other rabbit holes and looked up, what other buddy schemes were there that hadn't, people hadn't responded to us or hadn't got the survey. We know it's really well established in nursing, midwifery, in certain groups of learning and like midwifery. Nursing, like learning disabilities and things like that. And we know midwifery is quite well established for particular groups. There were some pockets of diagnostic radiographers, and there were some pockets of ODP courses, buddy schemes that had been set up particularly for those groups. But when we inquired about those had paused during the pandemic, and they were deemed that they need to be reviewed, and they were sort of fit for purpose. Physiotherapy and OT do have them as well. So there are AHP ones that we were aware of from the limitation of our data, but there was more appetite and interest for developing more ones specifically for AHP groups. When I looked at buddy schemes and when I looked at the scoping exercise, I had a view in my head that buddy schemes were a certain thing, and then as you understand more and more, you understand that they're much bigger than you think they are. So we did collate evidence on PALS and PAS schemes as well, so that, like some of the students have talked about, the clinical skills workshops that were integrated into them, as well as the ones that were just the pastoral and social support, just the friendship focus as well. So I couldn't give you a figure, Kathy, to come back to that really. Sparser than we thought, odd pockets, but a variety between sort of year 1, year 2, year 3, and more were probably developing or had been developed into foundation year support, so year 3, and into qualified professionals or into sort of band 5s and things like that.
Thank you, that's helpful.
In terms of following on from what Yogita's just said, there was a paper that came out specifically for radiography, for both diagnostic and therapeutic radiography, and that showed that there was a bit more of an uptake of those for those professions moving on from 2021. How established some of those are at the moment, I'm not entirely sure, but there was definitely more scope for those particular professions, as they'd had that investment in that from the Society of Radiography.
Thank you, that's interesting.
Thank you, Kathy. Victoria, do you want to come in?
Hi, yeah, I'm Victoria London from Birmingham City University. I'm just interested in the recruitment of mentors or buddy mentor, in the buddy scheme, the person who is more experienced in that respect, who's supporting the person on placement, be it a qualified or a student from a different level. Was there because I know we've tried to set up buddy schemes in university, not specifically to do with placement, just into year group buddy systems, and there's been some challenges, and I suppose I just wondered what your recruitment and how you identify those people to be that kind of buddy.
So in terms of are you talking in terms of De Montfort University or in general as to what the scoping exercise
Yasmin, I
produces?
understand it meant it was a buddy to one of the students, is that correct? And so I suppose it's how did Yasmin come into that role? How was she, did she volunteer? How do you recruit people to be in that role?
I'm going to hand that over to Ali.
Thanks,
She's
Ali.
Yeah, hi
course lead.
Victoria.
Hi.
Actually, we've integrated mentoring and buddying into the curriculum and into particular modules, so it's part of a module. So we actually assign mentors. Every third year is assigned to a first year, and sometimes we have uneven numbers, and in those cases we have little groups. Yeah. It's integrated into the timetable, so we align the timetables for first and third years for those sessions where they need to meet, and that's based on experience, because when we didn't do that, it was hard for those students to get together. The other element of it is that there's a piece of work, and I think this is crucial, that it's tied into their assessments. So for third year, as a mentor, they have to reflect on their experience and provide evidence of their mentoring session, and they collect feedback from their mentee, and the mentee is again, as part of their first year, they have to give that feedback and then show us that feedback as part of their portfolio of developing professional skills. And we found, I mean, we've been doing this for years now in this format, but we've found that the more it's embedded and integrated into the module and its assessment, that the stronger that is. But because then there's no discussion, there's no, we deliver a lecture and support about the setup and then how to do that piece of work that's related. So I'm sure the students might have some questions about how we do that and suggestions about how we could improve it. And we do actually group mentors together. Now, I know that that's not always ideal, because what we do sometimes get is some mentees who are just not ready to be mentees, you know, they're just not interested in it, and that's really hard for a mentor if they've got a first year who doesn't want to engage. But we say actually that's like working with clients and people that don't want to engage, so reflect on that experience and the strategies that you use to try and engage them. So that feels the most comfortable kind of setup for us. I don't know if that helps. Just that's obviously just one way of doing it.
Yeah, and I think, like you say, embedding it into the curriculum and making it kind of an expectation, and the outcome of that being really clear, is obviously going to make it much more successful than a more voluntary ad hoc kind of setup. So thank you, Ali.
I don't know if the students want to add to any of that, how it feels like to be allocated in that way. We just throw you into a pot with not knowing who first years are when we allocate. So
I think, like you said, Ali, it's all about finding the right approach as well. And like you said, with in our profession, we're going to do that anyway. So it's all about, you know, finding the right approach, compatibility, that sort of thing. And kind of works our way with it. It is useful. It is a good tool in adding to your knowledge and understanding. And if you have any questions, especially on I feel like at first year, I think it's quite beneficial in putting your foot in the right direction. So yeah.
I should just add, the guidance that we give to students is we sort of make some suggestions as to what could be covered in those first through few sessions, but really it's guided by the students. Then, you know, if there is specific, often for speech therapy students, they want to talk about phonetics, for example, and particular areas of the curriculum that they've struggled with or struggling with, or their first assignment. So it can, and we know that just reading through the reflective work that the third years do, just how much work they put into it. And that's, I think there's a huge realization for third years as to how much they know. Wow, don't I know so much compared to a first year? This is really good revision and kind of structuring for when I'm soon to be graduating. So I think that's a recognition and a confidence. I see the confidence grow in students when they become a mentor at this point.
Aisha, do you want to add anything from a diagnostic student point of view?
Yeah, I mean, the way we met our mentors was really nice. I mean, we did 2 sessions before that, which was like team building activities. So I did kind of know her before she actually became my mentor, because we were in a group together. We had to do these sort of team building activities that related to communication and things like that. It was a lot of chaos because it was just so many people, but it was a lot of fun. And that's just how we met. We just seemed compatible from then. I think you can really test your compatibility through those sessions. But yeah, that's about it.
Thank you. Are there any other questions? Just looking into the chat, see. I've seen Dawn's comment about looking into it for the ODPs staffs. So that's absolutely fantastic. Thank you for that. And Donna, thank you very much. Yeah.
Do you want me to pick these, Jenny?
Yes, that'll be great.
I mean, just answering Kathy's question, that it's not really a choice, unfortunately, because of the way that we've integrated it. So, yeah, we get students who are feeling nervous about it for sure. In third year, but like, I don't know anything. What have I got to offer as a mentor? And that's where the support comes in, and the kind of session, and there's a guide sheet as well for the students, and that connecting it very closely to the HCPC standards which Yasmin referred to, about communicating effectively, working appropriately with others, reflecting and reviewing your own practice. It's really crucial for that. So it kind of just reminds them, yeah, you're a third year, you might be nervous, but this is important and it's part of what you need to be doing. So that's really answered that one. And then in terms of hours per week, again, the students can probably answer this better than I can, but we recommend that they meet, I think it's 4 times, or 3 or 4 times, and they do a bit of planning. We ask them to plan for that session with their mentee. But we would be recommending, not to be spending hours and hours on it. They contact each other, I think, informally, again, as students have said, via WhatsApp or a phone call or Teams. But it's not a huge amount of it's not a huge amount of time. I understand. I've never heard anyone kind of complain about the amount of time. Whether that's correct, students, now's your chance to shout and say.
Yeah, to add to that, we have a set amount of times that we meet our buddies, as Ali was saying. So I think it was 3 times, and it's spread out throughout I think a duration of 3 months. Sorry. So with my buddy, we had it was timetabled, but sometimes we can't make it to those specific times. So we might say, out of our own hours that we're free. For instance, we might do Microsoft Teams instead of face-to-face if it's more appropriate. And if we do Microsoft Teams, we dedicate it, say, an hour. We do go over the hour sometimes. And if there is any other questions and we've got places to be or work to do, we just informally, like Ali was saying, give each other our numbers. And if they have any sort of questions that we might not be able to answer in that specific session, we can go and find the resources and direct them to an area for them to look into, and so on that sort of way, or email. That's like, yeah, that's really it. Yeah, not too much work. It's not too much. It's pretty. It's enough time dedicated for us to work between our work, our placement and our mentee, so that's okay.
Thank you, Yasmin. Yogita, do you want to come in? Oh, you're on mute.
Just coming back to the question about the final year students, for the ones that, for the buddy schemes that aren't embedded in a curriculum, as Jenny was saying earlier, growing your own really does help. So if they have a really great experience, which the majority of them do as a junior buddy, and when they're recruited and when they're exposed to buddying and they know the benefits of the scheme. So Ali and the students talked about the HCP standards of proficiency and really selling their professional development, how it's going to look good on your CV. They then have a really great experience and they want to give that back, so they develop those foundation skills that they're going to take into preceptorship a lot earlier. So it's almost like self-fulfilling, really. A lot of them do on, most of them go on and then become senior buddies because they want to give a little bit back because they find it so useful. I think the other thing to mention as well is that a lot of the universities link it to any extracurricular awards that they have or certificates that they have in the university. So they they get this award because they've done something extracurricular, and this can be part of it. That they've developed communication, professional development, leadership skills, management, organisation. I think that's a really good thing for their CV when they apply for jobs as well. And buddies seem to like that as well.
Thank you, Yogita. Are there any final questions? Thank you so much for the other comments in the chat. If not, I have the final thing to let you have a few extra minutes at the end. So thank you again once again for coming to this afternoon. I hope you found it really useful. If there are any additional questions, if you want to email them to us via the email that's on the screen, and then we'll get back to you as quickly as we can. And also the last little plug is for the Midlands AHP network, which you can sign up to. So please do sign up to that to be able to get more information about other things that are coming up in our area. Unfortunately, my poll hasn't worked, so I can't ask you to put an anonymous poll in the chat on how you found the webinar, but any feedback into the chat, please, or through email. I would be really, really grateful for how you have felt this session has gone. All right. Thank you ever so much, everybody.